What's up, everybody? Hey, good morning. This is Sunday morning. Headed in. It is 7 a.m. Got a case at 7:30 Sunday morning. That's right. That's how I roll. That's not how I roll, actually. I fucking hate doing cases at 7:30 on Sunday morning. But for this patient, she wants to go home this weekend, so I decided this was the time that OR can do it. So I was like, okay, fine. Anyway, in this video, I want to talk about a strategy that you can use to get yourself ahead of your competition, as in other students, other residents, other employees, other doctors, other nurses, whatever it is. But first, I want to tell a little story. So I have worked at several different hospitals, probably like 15 total or something like that. I worked for a locums company for a little bit, which is travel. And then I worked for a company that has multiple hospitals, that like staffs multiple hospitals in multiple states. By the way, I gotta sit right in there. God damn it. It just makes me mad. And then I squeezed it this morning so it's all red. But anyway, so I've worked in a lot of hospitals. And when you are in my job, you have a lot of decisions to make. And you also see when decisions are made poorly by other people, what happens in the long term. So what I mean by that is when the ER doctors see a patient, they see them for a short period of time, and then the patient either leaves the hospital or they go upstairs to the hospital, and they stay in the hospital, or they have surgery or something like that, and then I follow them. And then I follow them until they don't have a surgical problem anymore, which could be just a couple days, and then I see them back in the clinic for 2 weeks, or it could be months and months and months. And I don't follow them as long as internal medicine doctors do, but I follow them for a long time. And so what ends up happening is I see that the decisions that are made initially, say like in the ER, and I'm not just saying ER doctors make bad decisions in this like everybody. So nursing staff, like, the lab, the x-ray techs, whatever it is, when they do something, if I ask to do something and they don't want to do it, then it puts me in a position to be like, look, I know this is going to cause X problem down the road, right? And in especially trauma situations or emergency situations, you don't have a lot of tolerance for somebody to question and or especially cancel your order. And so that will get you fucking heated in a hurry. But I've done it both ways, and I'm going to explain to you what that means. I have got really angry at people for telling me not to do something, or they don't want to do that, or whatever it is, or questioning what it is, because they're unfamiliar with the situation. It makes me look like an asshole, and it really doesn't get me anywhere. What does work, though, is to discuss with people the question, whatever it is, and get everybody's opinion, and sort of look a little stupid in the short term, because I found that over the long term, if you do this, people respect you more and they listen to you more, and you can talk out this scenario with them and show them your knowledge. If you just yell at them and tell them that I'm smarter than you and I have more experience than you, that's not going to work. But if you talk it out as in a question type of thing, and you kind of lay out all of your knowledge, then they come back, and the next time that you have that situation or scenario, they don't really question you as much. What I'm saying is, you have to be willing to look stupid in the short term to benefit in the long term. And this is something that's hard to do. It was hard for me to do when I was younger. And the more experienced, not older, I get, the more I realize to be patient and to be able to not look, sometimes you need to look stupid, but be patient and respectful in the short term so that you can gain more respect and not really authority, as sort of authority in the long term. It just helps. So if you're in a job or you're in school, that will help, or whatever it is. It doesn't matter. Like your peers, your students, student peers, your peers at work, all that will help. Eventually you will be ahead with that. So this is not a concept that I thought up myself. I was actually watching a TV show and they talked about this. I was like, that is really applicable to medicine, because I've had several hospitals where I go in and I'm the new guy and nobody trusts me. Every time. It doesn't matter who you are. It doesn't matter if it says surgeon on your coat or whatever. You're the new guy. Nobody trusts you yet. So you have to earn those people's trust. And I found the best way to do that is to just talk it out. And this is really interesting because this is something I didn't do on my oral board exam. This is something that they want you to do on your oral board exam, is to talk out the problem. And if you can do that with, the people that are important that you're working with, then you will have a much better time in that hospital or in that environment going forward. Anyway, not a real heavy one today, not a real exciting one, not mind-blowing, but I thought it was a good concept to talk about. You guys let me know if you have come across this concept and if you're using it, or if you think it's a good idea, or if you've got, how about a funny story? How about a funny story of you doing the opposite and then everyone being pissed off at you? Those are always good stories. Tell me those. Subscribe, share, like, and definitely comment, of course. And hey, you guys, I have this study course, and I basically got a 1.7 GPA my second semester in college, and then I figured out how to study, and then I got straight A's after that. That's what I teach in the study course. It's how to stay motivated, how to concentrate, how to focus, all that good stuff. Check it out, secretstudyhacks.com. We also have a community of awesome students, mostly medical-oriented, nursing, pharmacy, PAs, NPs, also, obviously medical students. Also a community of mentors that have been there and done that and can help you. So check that out if you like. If not, keep watching these videos because I think they're pretty fun. I mean, I'm having fun. I don't know about you guys. Anyway, I'll see you the next one. Take care.